Quality dyslexia therapy comes down to two main components. First, the level of training of the professional conducting the intervention, and second, the fidelity with which the program is being implemented. Both of these reasons are often why school-based interventions are not impactful for all students with dyslexia. Schools are limited in time and resources, but they're required by law to service our children with dyslexia. As a result, schools often place a teacher with limited dyslexia training into this pivotal role and are not able to implement their chosen curriculum with fidelity due to scheduling constraints. In the same way, you cannot have a teacher do a 5-day training in treating speech impairments and expect them to take on the role of the school's speech and language pathologist. You cannot ask a teacher to do a 5-day training or even a month-long training on dyslexia and become the dyslexia interventionist for the campus. Students with dyslexia do not come in a one-size-fits-all, and we cannot treat them that way. They have different personalities, severity levels, and comorbid conditions to consider. When you do not have someone highly trained, when the program isn't impacting the student and they're not making progress, that person doesn't know how to troubleshoot. They know little more than how to turn the next page in the lesson manual. This is one of the breakdowns in the school setting when they're not hiring top-tier dyslexia professionals. It is so important that you have someone highly trained in dyslexia who understands how to adjust the program to tailor it to the specific needs of each dyslexic child they come across. When you combine this expertise with the implementation of a program with fidelity, you achieve success. So parent tip, always ask about the level of dyslexia education and training of your child's dyslexia teacher. Now let's speak about fidelity. There's not one magical program that perfectly fits every child every time. The same way there's not one pill that cures every sickness. This is why I feel that we place less emphasis on the curriculum, assuming that they're using an evidence-based dyslexia-specific program, and that we need to put more emphasis on the quality of the dyslexia professional and the fidelity with which the program is being implemented. If it is evidence-based and research, this means that there's already proof in the pudding when the program is delivered with fidelity. School schedules integrate many days off, field trips, teacher work days, testing dates, and school programs, and it's extremely challenging to implement any curriculum with fidelity. Also, programs generally have an allotted daily time that they're supposed to adhere to. This is often not taken into account when developing school schedules and class lengths. When fidelity doesn't occur, students are not getting the needed exposures they need to be effective. So parent tip, always ask for documentation on the fidelity standard of their chosen program and ask for their implementation record. One final area that wasn't addressed but can be very impactful if you have a child with a more severe, complex dyslexia profile is the importance of individualization. Due to a lack of time and resources, schools are faced to do group intervention on campuses versus one-on-one instruction. This makes it almost impossible, even for the most qualified dyslexia professional, to individualize to every student in that group, and many get left behind. This is the point at which therapy turns into curriculum delivery, since we can't be prescriptive to the needs of each child in that group. So parent tip, always ask about how many students in the dyslexia group exist at school. At Dyslexia On Demand, not only do we exclusively hire certified academic language therapists who are the top level of dyslexia therapists possible, but we implement only therapeutic grade, evidence-based curriculum with fidelity. Our one-on-one approach is individualized and prescriptive to the specific needs of every child we work with. When you work with Dyslexia On Demand, you can trust that our expertise, individualization, and therapeutic programming set us apart. Please visit us at dyslexiaondemand.com to schedule a personal meeting with me to learn about how we can change the life of your child. And please like and follow for more educational videos such as this one.